Welcome to the Restorers Podcast. We're excited you've joined us today. This is episode 6, and our focus today is going to be on physical health and homelessness and how they interact with each other and can complicate matters. Our guest today, we're really excited to have Dr. Chip Mershon with us from Penn State Health Cornerstone, which is located in Lititz, not far away. Mm-hmm. So thank you so much for joining us, Chip.
Oh, I'm really happy to be here, Jack.
Great. And full disclosure, Chip is also a member of our board here at Water Street, the chair of our Water Street Health Services Board, and actually was integral in founding our medical clinic here. So we're grateful for all that you've done for Water Street through the years.
Oh, I've been happy to.
And but today we're going to look at kind of the insights that you would have, not specifically about our clinic, but about health. And how physical health factors can really impact people who are living in poverty, who are experiencing homelessness. And I want to start right there. In your experience through the years as a doctor, I'd love to hear, where do you see those two things integrate, poverty and physical health, and what are some of those critical kind of intersections of those two things?
Sure. I think that's a great question. So often I think people think that those who come to the mission come because they had a drug abuse problem or those sorts of things, but or alcoholism. But clearly, physical health issues is another adverse event, if you will, that brings people to the mission. And oftentimes it's a spiral or a series of events. They might have an accident, for example, a motor vehicle accident or some other kind of injury that puts them out of work. And then because they're out of work, their health insurance oftentimes was through their employment. And so they're now out of work, have a physical problem, and have no insurance. And then they can't pay their bills. They can't pay their mortgage or their rent or whatever. And so it becomes a downward spiral, which can oftentimes lead to homelessness. Right. So clearly they're very much involved, and I would say that's one of sort of the three things that causes homelessness in terms of what I see at the mission. One is obviously the addictions issues. Right. A second one is mental health issues, and a third one is some physical issue that caused that downward spiral.
Yeah, and it can be a traumatic incident. It could be a diagnosis and a chronic
Absolutely.
Health issue that's just makes employment or other management of other life factors that much more difficult for them.
Sure. I mean, it could be that cancer diagnosis, for example, or it could be complications of diabetes or heart disease or any of a variety of things. It doesn't have to be an injury. Yeah. Although an injury is oftentimes a very abrupt and a kind of episode that triggers that spiral as well.
Well, and you mentioned, the three things that in your experience are big precipitators of homelessness and people coming to a place like Water Street. I think even more nowadays, we've seen the interaction of two of those, right? So the physical health and accident.
Absolutely.
And addictions. I'd be curious to hear your perspective from the clinical side as a doctor looking at that and how that's exploded. It seems to, at least in my mind, in my time with Water Street, that seems to become a bigger issue is addiction to prescription drugs, leading then to addiction to illicit drugs.
Sure. Yeah, I mean, those three things that I mentioned are by no means independent. They're oftentimes interwoven. Right. And yes, so for example, someone is in a car accident, has serious injuries, maybe orthopedic surgeries and so forth, gets put on narcotics to deal with the pain post-surgery, and then becomes a chronic addiction to that pain medicine, and then the doctor cuts off their pain medicine, and now they turn to street drugs. So certainly that's one of the like you said, increasingly common mechanisms that brings on that spiral we talked about.
So thinking about how that cycle can occur from a singular incident, a health episode that leads to poverty, that leads to homelessness. Have you encountered that in your work here at Water Street?
Oh, yeah, all the time. I can think of one fellow who was, he had a good job, an excellent job, actually, good paying job, had health insurance, house in the suburbs and wife and family and so forth, and was in a motorcycle accident. Oh, wow. and he had severe injuries to his legs. He ended up having multiple orthopedic surgeries, and was out of work. He was out of work so long that basically he was let go.
Wow.
Lost his health insurance. Basically, then, like we talked about, got addicted to narcotics.
Wow.
And his wife left him, and then he's on the street. And so he was. If you'd looked at him a few years before, you would have said, this guy is no risk for homelessness whatsoever.
Wow.
But all it takes is that one incident. In this case, it was a motorcycle accident, but
Right.
others were, fell off a ladder or a car accident or whatever,
Wow.
or even just health issues that leads to that downward spiral and leads to homelessness.
Yeah. And I know we've even seen episodes where it's the health of a partner.
That's true.
And where somebody else, and you're relying on two incomes to make it, and suddenly you can't pay the rent anymore because your significant other is no longer able to work.
Mm-hmm.
We've had families come here with that same scenario. So that interaction of health leading to homelessness, and then health being exacerbated through the experience of homelessness can be a really rough cycle. Once again, reminding us how important it is to have health care right here on campus.
Right. And of course, then the other direction is those health problems keep them from getting a job, keep them from getting a place to live, keep them from rebuilding that social network that is so critical.
Yeah, it can be a vicious cycle if we don't intervene and address those things.
Yeah, and of course gives us the opportunity to get them on the cycle the other direction.
Yeah, and I think, for many families, even that kind of toxic spiral leading to addiction, depending on your circumstances and connections, you might be able to, weather that storm. Mm-hmm. And I have close friends who have gone into rehab because of that exact kind of scenario that you described. They never ended up homeless,
right?
Because they had those supports in place. And we've talked about that in some of our previous episodes, that there's that relational side of it, that lacking relationships can lead those traumatic events to have so much of a greater impact and really lead to a further downward spiral. Mm-hmm. But I think it's good for us to understand that you bring poverty into the equation too, or lack of personal relationships, and then that scenario that you're describing doesn't just lead to long-term addictions issues and those problems, but literally homelessness.
Yeah, you're right, and that lack of a safety net or support structure is so much of a part of it. Because if you have that support structure, you can get through it, but without it, it takes less and less to bring on the spiral, if you will. And honestly, those kinds of events, whether it's you lose your job, you get addicted to prescription pain medicines, a lot of times what that does is tends to isolate you from some of your support network as well. You may have had it before, but perhaps you've driven them off because of the consequences of your actions, addictions, or even the events themselves.
Yeah. So far we've talked about how physical health issues can lead to poverty and homelessness. There's the other aspect too of living in extreme poverty, experiencing homelessness itself can lead to health problems.
Exactly.
Or exacerbating existing health problems. I'm sure you've encountered that in your practice before. Can you tell us a little bit about what you've seen? Maybe even what are some of those common things that somebody who's in extreme poverty or homelessness tend to experience more than the general population?
Yeah. Well, there's so many health problems that we take treatment for granted. Whether it's diabetes, for example. If you have access to the drugs, you can control your sugars. You can control and prevent the complications of diabetes,
or affording a good diet.
Exactly. If you're poor, you may not have the access to the vegetables and fruits and better foods. You may be more limited in your diet choices, and of course lack of easy access to healthcare, to physicians, to clinics, to whatever. And health insurance, not being able to pay for it, not being able to pay for medications, not being able to pay for doctor visits, all those things, add up. If you're in poverty, it can result in poor health, and then poor health makes it harder to get a job, maybe makes it impossible to get a job, and then
Right.
it becomes, we're
And
back
the
to that
circle
spiral
spins
issue,
around again. Yeah. Wow.
So one thing chases the other, so it goes both directions.
Yeah. What would you say are some of the most common health issues that seem to be exacerbated we find among our guests here at Water Street, or among those who are on the street homeless or just dealing with extreme poverty? What are some of the most common health issues that you see among that population?
Well, certainly diabetes is very common. Diabetes is very common in the country as a whole.
Right.
And it's such a big problem because the consequences physically are so pervasive. It can cause so many downstream issues in terms of physical health. So that certainly would be one. Things like high blood pressure and heart disease. Heart disease is another one that, if your heart's not working, it has impacts on all of the rest of you, for sure. So those are two that are probably some of the most common ones, but there are many others.
Yeah, and we see a lot of them here at Water Street. And,
absolutely.
So the addition of having Water Street Health Services here on site at Water Street, a medical clinic and dental clinic, has been so important to helping our guests on this journey. And so thinking back, you were a key part of making that happen, of kind of spurring the board on to say, we really need to take this seriously. We can't just, have guests here and say, you need to deal with your health. Why don't you go find a doctor or get a new primary care physician and get this taken care of. So I'd love to hear a little bit of that, kind of what really motivated that,
Sure.
and how you saw the importance of having it here on site in the lives of our guests.
Yeah, well, I should say, the board that was here at the time and the president at the time understood that even before I came on board.
Right.
So I didn't really initiate it. They basically said, it seems to us that there's a connection between physical health and homelessness, both directions, as we've already talked about. And so they kind of came looking for me and said, we think this might be a problem. What do you think? And I said, absolutely. And with only minimal arm twisting, they brought me on, and we got the clinic started back in the early 90s.
And so what, when you think about that, the early stages with basically a converted closet being used as an exam room and,
where your secretary is now.
Totally volunteers coming in, only now we've expanded and done so much. But what were those critical things about having it right here on site that you felt was like most important?
Well, I mean, access is many things. When people think access, they think, do you have insurance? Do you have money? But, honestly, location is an access issue, a huge access issue, because a lot of the people that are here, they don't have easy access to transportation.
Right.
They may have fears about the healthcare system. They may have prior adverse experiences with the healthcare system. They need somebody who's here right where they are and meets them where they are, with the limitations they have, and say, okay, how can we take you from there to the next step to try and move things along? So I think that access piece was critical to have it where it's available for them.
Right. I know we find it can be difficult for our guests to keep appointments when it's 2 or 3 blocks away.
Yeah.
And we've dealt with that with some of our addiction recovery programs that we partner with some of our housing programs we partner with, just making those appointments, let alone something that might be even a little more fear-inducing around physical health. And
as we've talked, and you're of course well aware, now we're talking more and more about how can we go out to the street. How can we go under the bridges, literally, and meet them where they are, even the next step along that journey.
Yeah, that's a really exciting conversation that's happening here at Water Street and also in the community. And it's been great to see Lancaster General and other health providers in the community kind of say, hey, we see the need for this as well. Yeah. And so there is actually a steering committee in the community that's talking about this right now. How do we do street medicine? How do we bring this out to those individuals who aren't even ready to come into shelter? But we still want to come alongside of them on their health journey. And that could be the first step to transformational change in other ways.
Exactly. Yeah, those backpack medics.
Yeah. And I think, bringing the clinic on site again. I do want to thank you. I know others helped twist your arm into that many years ago, but I don't think it would have taken the shape and form it had without your leadership on that. Excuse me. I think that's the legacy of that as well. Just the impact it's had on so many of our guests. We're grateful for, and you continue to volunteer on a regular basis.
Yep, I came here from the clinic this afternoon.
Right, and so we love that. We really appreciate your help in all that you've done to help get it started and keep it going. We're going to be talking in the second half of our interview with Jean Benedict, who is our Director of Medical Services. She's a nurse who's been with us for many years and worked alongside you in this project.
She's a gem.
She is. So we'll go a little more detail about those health issues for our guests here at Water Street in the second half of our conversation, so stick around. I want to give a profound thanks to our Season 1 podcast sponsor, Rogers & Associates, who's helping us tremendously in this first year of the Restorers podcast. They're a wealth management firm that helps clients become financially independent for retirement. You can learn more about them online at rogers-associates.com or by calling 717-560-3800. That's Rogers, RODGERS-associates.com, or by calling 717-560-3800. Thank you so much, Rogers & Associates. Well, welcome back. This is the second part of our conversation here in our 6th podcast, and our focus today is around health and people experiencing homelessness and healthcare and issues that our guests often face. Had a great conversation with Dr. Chip Mershon, and now we're excited to bring Jean Benedict in to share with us for the second part of our conversation. Jean is our Director of Medical Services here at Water Street Mission, and she's been a part of the organization for a really long time and in a lot of different roles. You actually started as a volunteer with us, isn't that right?
I did, as a volunteer nurse.
Yeah.
Yes.
How long ago was that?
And over 25 years ago.
Wow,
yes.
Fantastic. So you've been here. We actually started around the same time.
We did.
And have had quite the journey, but appreciate your leadership over there and the impact that you and the team are having. So thinking about these issues, we were talking earlier about common issues among people experiencing homelessness. From your perspective, you've been hands-on in our clinic for a number of years. What are some of the things that we see here? We hear the statistics and what's happening in the world around us, but among our guests, those who come to Water Street in need of help, what are some of those common health ailments that our guests are dealing with?
Sure, yeah. There is definitely a common thread through the years that I've certainly seen, but I think, currently some of the biggest issues we see are diabetes, which is just probably increasing, over the years, and hypertension. Those are always big issues. But then mental health is huge in our population, as well as chronic pain. We see a good bit of chronic pain as well.
And I'm guessing that's from a variety of sources. It's not just, one genesis of that. It
is, yeah. A lot of chronic back pain, but it can be fibromyalgia, joint pain, just a lot of different chronic issues.
I'm going to venture something here, too. I wonder, is there... we know, and we've actually talked about in one of our other episodes around substance abuse and mental health issues and how there can be a chicken and egg type of thing sometimes.
Right.
So chronic pain issues can also lead to opioid addiction.
It
correct?
Sure can.
And
yes.
Do we see a lot of that interaction among our guests?
Yes, we do see that definitely where you don't always know which came first, but there can definitely be we see a lot of that connection. And
how do we kind of try to identify and address? Because if we have somebody who's in recovery, who's working to manage their addictions and get to a better place with that, yet they still have chronic pain. I'm guessing having a medical clinic on site is helpful. But
it is helpful.
How challenging can that be?
That can be very challenging. In fact, I'm currently working with a gentleman who is in that very scenario, dealing with pain, but also, knowing his addiction history and not wanting to put that in jeopardy, either. And so that can be very challenging. I think we definitely have resources in getting people into pain management and looking at what options, what other options there are.
Yeah, and that actually leads to another thing. Let me preempt this question by having you describe a little bit of how we do our medical clinic, because if we have, and you'll share this part, I'm sure, but we have volunteer doctors involved. I know that part.
Yes.
And volunteer docs who may not deal with a lot of homeless individuals in their normal practice. So even being able to look into that and address the addiction kind of co-occurring with physical ailments, you have to provide some guidance to that. But I'd love to hear first, how does our clinic work?
Sure.
A lot of people, I'm sure, are wondering. We don't have a staff of physicians that we've hired, but we do have a director who oversees a lot of great work. So how do our clinics work?
Yeah, so we do have a broad volunteer team that we work with. We have a small staff and then a big volunteer team, which has been wonderful. So all of our providers, our physicians, nurse practitioners are volunteer. We run clinics in 3-hour sessions so that it's easier for people to come in and volunteer. Right. And we always have at least one staff nurse on running the clinic. And that kind of speaks to what you had mentioned. We do have providers coming in that may not be as familiar with persons living in homelessness, but also may not be familiar with the program here and how things work. And so we rely on our staff in those situations to really come alongside our volunteers and provide some of that information.
Yeah, so it's a balance of the medical expertise that they can bring, but then also how does that fit with our program and with that individual guest's journey and what it is that they're trying to address and deal with. If they're like, look, I can't do Suboxone, tried that before, for whatever reason, as part of my recovery, and I can't do any opioids for my pain medication because it's going to take me right back down.
And that is really relying on the staff kind of for to give some of the social determinant input for our providers as they treat.
Yeah, that's a great collaborative approach. It is. And so that we've got the insight into program and the guests, and then we've got the medical expertise where we don't have to hire that up. Right. It's part of one of our core values is partnership with the community. Yes. And knowing that there are people who can provide things for our guests that we can't. And appreciate your ability to manage all that and keep them working together and moving in the same direction. So when you mentioned, we were talking about some of those common ailments that our guests are dealing with. I'd be curious, the lifestyle or the life circumstances of somebody experiencing homelessness. They may be couch surfing, they may be on the streets literally, or living in the woods somewhere prior to coming to us. Struggling with where they're going to find healthy meals from day to day. How do those contribute? Are any of those health ailments that we see that are common, are they exacerbated by that lifestyle? Probably the wrong word to use, but that way of having to live life for that season. How much does that make those conditions worse or even contribute to their onset with hypertension, with diabetes? Yeah,
it certainly contributes. And I think there's a lot of those barriers that can lead, and just take diabetes for example. So someone who's living in homelessness may not have consistent access to meals or to healthy options. They may not have even supportive relationships around them, even in trying to make decisions about their health. They may have barriers to communication and transportation and getting to appointments. And so I think what we see a lot of times is some of these health conditions go either undiagnosed or untreated for quite some period of time, perhaps while they're living in homelessness. And so when they come in to the clinic, sometimes there's just been things that certainly have been exacerbated. We have A1Cs that are through the roof for diabetics who just haven't been able to engage care for multiple reasons. Do
most of the guests know their conditions before they come in, or is it kind of sometimes an undiagnosed and not just untreated, but they didn't even know they had it?
Yes, it's definitely both. So we definitely, there are undiagnosed, diabetes is one, and prediabetes that is found not uncommonly. Yeah.
And I'm guessing, that, and we talked about this in an earlier podcast, I think around mental health, but that survival mode when you're on the street. So your priority when you're on the street isn't necessarily what's the healthiest food that I can eat in light of my condition. It's where can I get something to eat?
Right.
And I know we've even had that conversation on site here in our dining hall around, wait a minute, why are we serving so many carbs and so many sugar-filled things? Like when a huge percentage of our guests are diabetic or borderline diabetic, and yet, and the great thing is it has changed how we approach our meal service here.
Right, it has. Yeah,
and a lot of that goes to conversations with our medical team and learning from you guys. So that's been a great addition here. I think one of the other pieces of the journey I'd love to hear from you is our guests who are with us, whether they're in shelter or they've taken that step to choose our residential track. Oftentimes they're dealing with really difficult issues of kind of getting to the roots of dysfunction that have led them to be homeless. But if they're not feeling well, if things just aren't right physically, that affects their willingness to move forward and address stuff. How have you seen that play out with our team, and how does that play into the importance of having a clinic right on site?
Yeah, so health has a huge impact, as someone is dealing with, a lot of their issues maybe that led to homelessness or looking at those things. What I've seen in working with guests, someone who's experiencing chronic pain and they're struggling even to sit long enough to be in a class, or, struggling to get around campus, and those things, are primary in their mind and life right then, because they affect their daily life so much. And we've had just multiple, recently in the last year or so, multiple guests who have been diagnosed with cancer while they're here. And, you're dealing with these very significant health issues while you're also trying to, look at the other pieces of your life. And that's very challenging. And so if those health issues can't be addressed or aren't addressed, I think it really hinders someone from moving forward in other areas as well.
Yeah.
And so the beauty of having clinic right here on site is that people can access that care without a lot of barriers. And so even though we can't treat everything on site, we don't have specialists coming in. We have family doctors. It's a great place for them to start. And get connected for care, and then we can do referrals. But walking across campus to the clinic is a lot less overwhelming than trying to figure out how you're going to get somewhere else in town, especially when you have a lot of other things.
And I know we run into that with our guests with all kinds of services, let alone medical care, but like whether it's addiction services, whether it's, getting a social security card, any kind of social service, that distance from here to there often feels like an insurmountable barrier to them. And so the clinic being here to start that journey with them, even if we have to refer out. And recently, I know there's been an emphasis in your role and actually bringing on a new staff member to join you around nurse care management. Can you tell us a little bit about, because I think that speaks to exactly what you're talking about, that overwhelming journey of getting care. How do we help with that? Yeah,
so I really think about how complex our health care system is right now, and so helping to navigate that is huge, and so as seeing that need, and putting this emphasis on nurse care management allows us to walk one-on-one with guests in helping to navigate, and to sit with them and help them to even try to make decisions about their health, because, they're here, they're alone. A lot of them do not have supportive relationships outside of here. And so when you're dealing with, cancer diagnoses, and
Right.
you're dealing with an upcoming joint replacement and, surgeries, which we have a lot of surgeries happening while people are here as well. It just really gives the opportunity to walk alongside of them, navigate the insurance issues, the transportation issues, trying to help remove some of those barriers and walk them through it, but also providing relationship.
Yeah,
in
I was
the
going to
midst
say,
of
I'm
that.
guessing the relationship piece of that can almost be
huge.
bigger
It
in
is.
their
I
mind.
believe it.
We may know that some things behind the scenes that we're able to do to help, but to them, it's
Right.
just that presence. I know I've heard that specifically from some of our guests,
Yeah.
like just how valuable it is to have you and Hannah to walk with them on that journey. And know they're not alone.
Right.
That's
right.
so huge. And the other side of that, too, is you're able to provide information back to our team
Right.
that's helping them on their residential journey to understand here's what they're really going through. And
Yes.
without disclosing anything that would be inappropriate or confidential, but to just let them, look, this is the journey this individual's on.
Right.
This class might be hard for them right now, or these expectations might be, you need to take those off the table. And so it can be collaboration between our medical ministry and our residential ministry to make sure we're caring for the person
It
well.
is. That's I think a really important piece. Yeah.
Yeah.
And just that teamwork of working together.
Cool.
Yeah.
How have you seen, I'd love to hear if it's a specific story or just in general, how have you seen the medical care that we've been able to provide lead to a sense of hope that maybe wasn't there? Because I know many of our guests come in and just they feel overwhelmed by the moment. They feel overwhelmed by everything in front of them. Even if they're beginning to choose to move forward, that lack of hope can be really hard, especially when you're dealing with my body doesn't feel right. I'm in
Right.
pain all the time, or I have this diagnosis that I just don't know what's going to happen. How have you seen that medical care speak into that change?
Yeah, I can think of, just offhand, I can think of two particular guests in the past that we've worked with who, again, they were in chronic pain because of need for joint replacements, and that pain was just really limiting their daily life. And it does a lot of times then, guests will begin to struggle, just with feeling depressed and hopeless, as you mentioned, because they aren't able to engage life, the way they would like to. And so in both of those situations, the guests were able to go through joint replacements while they were here in shelter. And just on the other side of that, just seeing a new level of hope and engagement in the other areas of their journey then.
Yeah, and it's amazing how all those things fit together and influence each other.
They do.
Right, and even I know I've heard some of our guests talk about I've felt this way for a long time, but I don't feel like dealing with it because what else is going to change? And maybe they start making progress around their addictions over here, and it opens them up to maybe I could get that fixed. Maybe I should go through with that surgery because there is hope on the other side, and vice versa. If I can take care of this, now I feel greater capacity to deal with these other issues in my life.
Exactly. Yeah, and I think we're fearfully and wonderfully made, and God has we're mind, body, spirit, and all of our physical health affects our mental health, affects our
we can't just set that aside and deal
we can, and I think I see that every day. You just see how complex really we are in a beautiful way.
Yeah, and it's such a blessing to have the Water Street Health Services right here on site, a full medical clinic, a full dental clinic, all those connections and supports for mental health with Phil Haven. And what a blessing that we can really come alongside the whole person.
Exactly.
And walk with them on their journey. So, Jean, thanks so much for joining us today, for sharing some of your insights into what our guests are struggling with and how we can provide hope on the medical side, which then can open the door to life change in many different ways.
You're welcome.
So, appreciate you being here. I hope you enjoyed our conversation today with Chip and Jean and just learning a little bit more about the lives that our guests are living and the struggles they're overcoming every day here at Water Street. Thanks for joining us.